Today we're going to be talking about Robert Woods, who's a wide receiver for the Houston Texans, and he suffered a hip injury that we call a hip pointer. So I want to dive in a little bit more about what exactly a hip pointer is and why some of the recovery time is so variable with this particular injury. So when you put your hands on your hips, you're technically putting your hands on top of your iliac crest, which is the large wing of your pelvic bone. And a hip pointer is essentially a bruise of that iliac crest. A lot of times people are like, what's the big deal? It's just a bruise. A lot of guys get bumps and bruises. They play a contact collision sport like football, especially at the high level like the NFL. So let's talk a little bit more about why this can impact a player so much and why the road to recovery can be so variable for these players. So these hip pointer injuries can leave quite the bruise, and a lot of times it's all of this swelling and this inflammation and this pain that people have that really holds them back during their recovery. And sometimes what will happen is people actually need to go on crutches for a few days because it's so hard for them to use certain muscles like the side of their hip or the front of their hip for their hip flexors when they walk. And so crutches are just a way just to help to get them through those initial few days. So all of these muscles that surround the hip and the pelvic area is what makes this such a difficult diagnosis with a hip pointer to manage and to treat, especially during the season. And so when we talk about some of the muscles, we're looking at things like your hip flexors, like your psoas, your iliacus, as well as your TFL. We're also looking at some of the muscles that can sometimes be impacted, like your groin muscles. And some of these guys will even say that they have so much bruising and swelling around their hip that things like coughing, laughing, sneezing, even going to the bathroom creates this valsalva, this pressure, intra-abdominal pressure, and that can actually reproduce some of that same hip pain as well. The big thing is that as the swelling subsides, some of those muscles will need to be retrained. So a lot of those hip flexor muscles, as well as just activating the back of the hip, especially the glutes, as well as the side of the hip, your glute min and med, that help you to push off or to do more lateral movements. So once we've got the athlete up and walking a little bit more without pain, we can start to reintroduce things like jogging and running and sprinting. However, we have to make sure that the hip flexor is able to contract without pain in order to promote that knee drive with sprinting, as well as the glute max on the back to help to make sure that they get a powerful push off when they sprint as well. The other thing is that the side of your hip controls the pelvis in terms of the balance to make sure that you can push off and plant, cut, and pivot as well for those skills players like wide receivers, cornerbacks, safeties, things like that as well. Now, hip pointers are not unique just to football. They can occur in other sports that have contact collision, lacrosse, rugby. They can occur in soccer, basketball. They can also occur in sports where people make contact with the surface. So sometimes we'll see basketball players that literally land on the side of their hip that can give them the same hip pointer that somebody who tackles somebody in football on the side of the hip will also produce a hip pointer. In football, one of the things that we're trying to do is we're trying to pad that area a little bit more in somebody that has a risk for a hip pointer or has already had a hip pointer, and to try to pad the pelvis to make sure that it's protected. Sometimes that's not always possible with things like basketball and soccer, but again, with football, we're a little bit more able to do that.